It is Health Monday with our friends from Marble City Pharmacy, Jared and Jacob this morning, and Merry Christmas to y'all.
Merry Christmas.
Almost there.
Before we get into what we're going to talk about this morning, y'all got a beautiful store for Christmas. I'm telling you, I don't know who puts that together, but y'all need to keep those people.
We would lie and say that it's us.
I know better.
I don't. Yes, we don't touch it. That's kind of the rule. you idiots, stay away from this.
Yeah.
It looks great. We're getting a lot of compliments on it.
no doubt
Plenty of
about
gifts for everybody, so there's your plug for the gift department. We got what you need.
No doubt about
All
it.
of
And
it.
I'm sure y'all get a lot of conversation about the topic we're talking about today, Medicare and changes for the calendar year 2026. What about this?
Oh, yeah. Well, this is what we talk about all day, every day. So, but everybody's interested in this, and I think the viewership of this program, this might be right up your alley.
Yeah.
Well, talk about, first of all, the lower prices for some medication. That's good news.
Well, you guys may remember this. This is either the second or third round of, I'm calling it Medicare price, negotiated price, whatever it is. They're dropping the price of some of the drugs, okay? This year on January the 1st, the main things on the list of 10 drugs are diabetes medicines and blood thinners. This is what most of you will experience from this. Here's what it means. Several of these medicines cost right now somewhere in the $600 range. If you have a plan where you have a high deductible in January, you might have to pay that entire price on your first prescription. In other words, if your deductible is $600 and your blood thinner is $600, the first time you get it in January, it'll be $600. Now that the price has been negotiated down to $200 to $250 for most of these drugs, then you're only going to have to pay $250, $200 to $250 in January. It's a big deal if you're on one of these medications. And I think the government's going to continue to roll down other drugs in the future.
Jake, all of us want to know about what is my out-of-pocket cost going to be and all this stuff. Talk about that.
People want to know the cost because that's the number one question, right? It doesn't matter how good the medicine is if I can't afford it. And so for this coming up calendar year, 2026, well, in 2025, for the first time ever, Medicare Part D plans, drug plans, instituted a cost cap of $2,000. And so if you paid your deductible here and your copay of this here, once that hit $2,000 for the year, you were done paying for drugs, at least covered drugs for the year. This year, they're keeping that in place, which is good news. They did slightly increase it 5% to its $2,100 this year. So when a person on a traditional Part D Medicare plan for drugs hits $2,100 in drug spend at the pharmacy, they go down to zero for the rest of the year. Some people hit that by March. Some people don't hit it all year. Some people hit it by February or March. And so zero for the rest of the year. And then although we have fewer people that hit this number, if you're on an Advantage plan, which that means your same coverage, your same insurance card covers hospital, doctor, drugs, everything else, that all gets lumped in. So your max out of pocket for this year, or this coming up year, is $9,250, which sounds like a huge number, but when you think about doing it the traditional way with Medicare A, Medicare B, premiums, deductibles, supplements, all this, that all comes up to about the same.
Ladies and gentlemen, if you think that's confusing, talk
It
about
is.
the Medicare payment plan. Speak to that.
You see why we have to talk about this all day, every day.
Yeah.
It's confusing for you guys. It's confusing for us till we take some time to figure it out. The Medicare payment plan is also something that started in January of 2025. Unfortunately, when Congress put together the Medicare drug plans, they made it to where sometimes your medications are this much in January and this much in February and this much, and it changes in the cost of the medication over the course of the year. If you're on a fixed income, that makes it very difficult for you to plan for how much your medication costs. The Medicare payment plan makes it to where you pay $0 at the pharmacy, and then the plan turns around and bills you monthly for the cost of those drugs. So for example, if you had $1,000 worth of medications that you needed to purchase in January, you would go to the pharmacy, you would pay $0, the plan would reimburse us, so everything works out the same for us. But then you get a monthly bill for that $1,000 instead of having to pay the lump sum all at one time. It was designed to make it easier on people month to month. If you participated in the Medicare payment plan in 2025, you're going to be automatically re-enrolled in 2026 unless you change plans. If you change plans, you have to re-enroll. But if that's something you did before, you'll be automatically re-enrolled.
Are the premiums and deductibles changing in 2026?
If I answer yes, everybody watching, listening, or thinking about this knows which direction they went.
Yeah.
Yeah, I would love to tell you otherwise, but no, there's no breaks coming here. So if you are on Part B, a supplement plan, something like like in Medicare, excuse me, not supplement, so I'm speaking wrong. Medicare Part B, things that cover your diabetic testing supplies, all of that. So we deal with that sometimes too. The premium for that went up to $202 a month, $202 and some change. The deductible for that went up, $283 this year. So they're just inching up on all these things. Part D, the drug plans, you can get for your premium, how much you pay a month to have it. There's some as low as $3 and change this year. There's some as high as $130 and change this year. Now, there's difference in the coverages, but you can get a much cheaper plan. You can get a much more expensive plan. So the range is there this year. Goodness, trying to remember. Oh, Advantage plans. They vary greatly as what your premiums are, but they're all up. Everything has gone up. I even looked, although we don't deal with it, I even looked for people watching your Part A costs. In other words, you have to go in the hospital. The deductible went up. The amount you pay per day went up. Everything went up. I know no one is surprised by that. I wish I was giving you good news today in that, but the costs are up across the board. Part A, Part B, Part D, supplement costs. I looked at C+. C+ went up this year too, to I think $216 is coming up year a month. Just everything went up.
So if everything continues to go up, what about low-income patients? How do they deal with this?
Yeah, well, first of all, Medicare drug plans provide lower co-payments. The government subsidizes this for people that they call on the low-income subsidy. These are your people who they call dual eligibles. Those are people who have both Medicaid and Medicare. And then for people who are on what they call Social Security's extra help. If you get a letter in the mail if you're eligible for this, right? So this past year, I think the maximum amount your generic medication could be is $4.90. Maximum amount your brand name could be is $12.15. Next year, that's going up by just a little bit. The maximum amount for generics in 2026 is $5.10. Maximum amount for brand names is $12.65. So that's a government program made to where if your income is low, there's a maximum amount that your medication can cost. Now, with that said, a number of these Medicare Advantage plans have $0 copays for people who are on the low income subsidy. So in other words, it might work to your advantage to be on a Medicare Advantage plan, which is doctor, drugs, and hospital all in one.
So, Jacob, the differences between traditional plans and Advantage plans, is there a shift going on here?
Yeah, and it's hard not to editorialize a little on this one, but there are some things that are just clear. So the companies that offer drug-only plans to you, your Blue Crosses, your WellCares, your Health Springs, all these same companies are the same companies that, on the other hand, offer an option for an Advantage plan. It's the same companies, your AARP, United Healthcares. It's the same companies you're choosing just from their drug-only plan or their Advantage plan, right? And you and I are never going to know what goes on behind the scenes of how they are reimbursed by our federal government for these things. But they are clearly incentivized and make more for themselves as the insurance company to have you, the consumer, on an Advantage plan. And the reason I know that to be is because it's a race to the bottom for drug-only plans, and the incentives to get you on an Advantage plan go up every year, whether it's grocery cards, free gym memberships, I'll give you some free over-the-counter drugs, just throwing lower copays, $0 copays, just throwing stuff at you. They're not doing that out of the goodness of their hearts, right? They're getting incentivized by our government to do that, which again, so they're making the decision for them. But the result is that these drug-only plans are what has been called a race to the bottom. Your deductibles continue to go up, your premiums continue to go up, your copays continue to go up, the quality of the coverage continues to go down, the list of covered drugs continues to shrink. They're making it to where it's hard for the average patient, the average consumer, to choose a drug-only plan rather than an Advantage plan. And I I don't know how all that works in the background, but I'm smart enough to figure out that they're not doing that for fun. They're doing that to some financial benefit.
Jerry, before we go this morning, this seems so confusing.
Yeah.
It's confusing. Does it have to be? No. I would choose my wording carefully. If they would just put myself and Jacob in Congress, we would have made this a lot easier to understand.
But we don't want to be there.
But we don't want to be there, and that's the problem.
All right, guys, thank you both for coming this morning. Appreciate you helping Monday with Jared and Jacob from Marble City Pharmacy. If you guys got questions, these guys have got answers. They'll be at the drugstore in just a little while to answer those questions for you and help you with Medicare and Medicaid and all that kind of stuff in 2026. That's a wrap for me for Daybreak Live this morning. Appreciate so much you joining.